it go.
Okay.
Anybody who wants me to start at the beginning. And of course, that was only 9 months after I was conceived. Anyway, what I started a special care nursery at Cardinal Glenner Children's Hospital in 1963. And we were instrumental we helped invent the ventilator. We invented how to take blood pressure on premature babies. We were the ones that invented nutrition in the vein. We identified the need for magnesium, the need for zinc, the need for copper.
Wow.
And we did it with metabolic beds. We did every intake and output and did these things. So we were a leader in the field of neonatology. The hospital still is a leader in the field of neonatology. But then I had a baby, Joseph, in 1975, who had flat brainwaves and was said to be brain dead. And it was suggested to stop treating him. I said, well, I don't do that. I treat babies, some live, some die, and kept treating him. And he did eventually get off the ventilator, and he went to school, and he got straight A's, and ran track and played baseball. And he's married, he has 3 children. So because of him, after about 6 months, when he continued to live and was doing much better than anybody would have predicted, I started to investigate brain death. And it took about 2 years till I understood the language of brain death. Brain death is a lie. It's a lie that's been told over and over again, so people don't even realize it's a lie anymore. But it's been a lie from the beginning, continues to be a lie. So I published in the medical literature. I have an article in Journal of the American Medical Association. I have an article in the Gonzaga Law Review. It's 85 pages, has 244 footnotes to it. And because of that, eventually I have continued to talk about brain death. Brain death is a lie. I have talked all over the United States. I've talked in many countries and on this subject and continued to do it, and that's because of different things. That's how I got to meet Ted Fogarty.
With the
I
H-spot.
didn't meet him myself, but through his cousin, who's a physician, and listened to what I had to say as we went to a football game. And she said, you should know my cousin. So that's how I get involved with this.
Nice.
But the truth is easy, and then once you deviate from the truth, then you have first it's this false, but then when people become conscious of it's false, then it's a lie. Brain death is a lie. The way it occurred was that Christian Bernard did the first heart transplant in South Africa in 1967. 3 days later, they did the second heart transplant, and you don't know where that is, but I'll tell you. It was done in Brooklyn, New York, and what they did is they cut the beating heart out of a 3-day-old baby and transplanted it into an 18-day-old baby. And at the end of their surgeries, a short time after the end of their surgeries, both of those babies were dead. It was illegal, it was immoral, and so they had to do something to make it legal. And so what they did is they set up a committee at Harvard, and the committee invented brain death. The committee did not do studies on dogs or cats or rats. They didn't collect data on human beings, they just invented brain death. And they had no patient data, they had no basic science studies. And I know it's really awful when you know about it, and it doesn't get better. It keeps getting worse after that. Then a lot of people think that brain death means flat brainwaves. They're not even required to do brainwave testing. The way they did that, they studied 9 patients, and 2 of the 9 still had brainwave activity. And then they concluded no longer is it necessary to look at brainwaves. So it's not required to look for brainwave activity.
So when they're doing the transplantation on people they say are are brain dead,
They're
never
all
going
alive.
they're all alive
Yeah.
and completely recoverable.
They're all alive. You cannot.
So they're harvesting organs out of people who are in some way conscious. They just can't communicate.
Well,
When they
consciousness.
feel pain,
Consciousness and pain. I encourage you to sharpen your mind so that you stay focused on one issue or the other.
sure.
Okay, and consciousness is important, but it's one thing not to demonstrate consciousness, and then we use words like unconscious. But unconscious does not mean that there's no consciousness. It just means that we do not observe consciousness. And there's a difference. So
It's like a subjective
right,
observation.
and whether a person shows consciousness or not does not indicate whether they're alive or dead.
Gotcha. That's
So,
interesting.
you use consciousness, and what else did you use?
Pain, that they
Oh,
feel
pain.
pain when,
Yeah,
when they
see,
take the organs out.
Pain is one of those things that's real, and we should pay attention to it. But pain is the way that the body knows that something's wrong, and it's the way that healing is initiated. Now, we live in a world where no one should have any pain. Well, there are some sayings: "No pain, no gain."
Right.
And every
Pain-free is not exactly a good thing.
in fact of the matter is, it's a bad thing. So focus on pain. Now, here's what happens: just because a person can't demonstrate pain doesn't mean they don't have pain. You know, a very good example of that is they give paralyzing agents when they take the organs, so that they don't move and they don't
Oh, that's
squirm.
so horrible.
And even if they don't move and don't squirm, when they cut on them, their heart rate goes up and their blood pressure goes up, which is the response to pain. But they can't demonstrate that they have pain.
Because they're paralyzed. They've medically
They're paralyzed,
paralyzed them.
yeah.
So they can't respond by,
Right.
oh, that's horrible. Horrible, horrible.
And it gets really bad if you pay attention to it. So in any event, they invented brain death mainly to get organs, but then also so they don't waste money on treating people who aren't ever going to get a job, who are just going to live and not die. And so you see what brain death is. It's primarily a way to get organs.
No, it's no different than what they did in Germany.
It's exactly what they did in
That's what I was
Germany.
saying. That's what I was
It's
telling
exactly
you.
what they did in Germany. And actually, in my research many years ago, when you had to do the research by going to what we call the stacks in the library to get the old journals, and I found articles in the Journal of the American Medical Association in 1919, 1920, of a doctor in Germany who wrote to Journal of the American Medical Association and telling them what the doctors were doing in Germany. He signed it the overseas correspondent and told the doctors in the United States what was going on in Germany, and that was before Hitler. So in many ways, what's going on in this country is very similar to what was going on then. And it took World War II to stop those doctors. But then what happened was that their records all went to the Russians.
But no, I thought that through the Operation Paperclip, that the doctors, we brought the German doctors to the United States.
Some of them came to the United States. Very few of them got charged with anything. Very, very few of the German doctors. And the German doctors were already involved in doing evil things before Hitler. Remember, I told you in 1920, Hitler didn't come into power until 1933 or 34. And Hitler was elected, by the way. Okay.
Sure, yeah.
He was elected and then became the dictator. And so yes, it is very similar to what was going on in Germany, and it was the German doctors. And I'm not opposed to doctors for lots of reasons, and I'm excited about many of the advances that have happened in medicine. But
there's a fine line, though. There's an ethical and a moral line,
right.
However, in a practice.
And the ethical and moral line, those are rooted in words. One is Greek and the other's Latin, and they are very similar in the sense that they both revolve around how one ought to behave. And ought is a very special word. It's rooted in the word owe. So it's how the doctor ought to behave because he owes it to his patient to behave in a certain way. So ethics and morals. And so what they've done to that, and like when I went to college and to medical school, I learned ethics. And I also studied biology. So, and biology is a study of living things, and ethics is how one ought to behave. So what they've done is put together bioethics, and they're like water and oil. They don't mix. You can't mix when you're studying what's already set in place. That's biology, with something with how one ought to behave. So you put them together and you get something that you can do anything you want with it, and they do.
There is actually no meaning behind that.
No, bioethics
do what you will.
is a field that they are not ethicists and they're not biologists. They are people who are trained to carry out something, and the way that brain death works is that they get the clergy and the people in pastoral care and to get involved, and then in organ transplants they have a designated requester, and a designated requester is usually a very nice person who dresses nice and befriends the relatives. Can I get you a cup of coffee? Oh, I know this has to be terrible on you. We'll do everything we can to help you. And all of that is part of getting them indoctrinated
procurement
to get their organs. And
I need to go take a shower.
see, and you cannot get any organs from a cadaver. Every organ that's transplanted is a healthy organ, and you can only get healthy organs from living persons. You cannot get any organs for transplant from a cadaver.
That's why you don't put it on your license.
And the things I'm telling you is that you are not allowed to hear, and because if you hear it, you will be upset, as all three of you are upset, and rightly so. You should be upset because whose organs do they want? They want the organs from certainly from all children, but especially the people who are 16 to 30, and their life is in jeopardy. If they're unconscious and on a ventilator, they're going to get their organs, and they do everything to get their organs. And once the organs are taken, you can't bring them back to life. And so what they do is they tell the relatives, well, your daughter Sally would really like to do something good, and this is a way to make something good out of this tragedy, or your son, and while they have been getting organs from accidents and gunshot wounds, they now get more organs from overdose of drugs than they do from accidents and gunshot wounds combined. There are 8 deaths a day from overdose in Ohio, and they get their organs is what they want. And so what are they doing? They're giving the policemen the Narcan to counteract the drug, which gets them into the emergency room, but it doesn't save their life. It gets them in the emergency room, and they still get their organs. And so...
It's so diabolically disgusting.
Oh, it really is. See, it's so bad.
It makes sense.
And
I can't even.
It's making sense.
Oh my gosh.
It's making sense.
Yeah.
now, just part of why when you were talking about unconscious and pain, and you might have talked about something else, what I'm encouraging you to do is to realize that there are common denominators of all of this. The common denominator is that each person is unique and unrepeatable and special. And a person is alive, but so are the dogs and cats running around that are alive, and so are the trees alive, but they don't have the life that the person has. And each person has that life, whether that person can walk or talk or show consciousness. In brain death, they do only 3 things for brain death. One is the patient does not show consciousness. The patient does not have brainstem reflexes that involve the eye or the ear. So there's about 14 brainstem reflexes, but they test only 6. They don't test the others. And then the test that they do that is called the apnea test. It's really not a test, it's a procedure. And what they do is take the ventilator away for 10 minutes. And the patient has to demonstrate that they can take a breath in that 10 minutes, or that becomes the signal to cut out their organs. During the time they're off the ventilator, the carbon dioxide builds up, the acids build up. That makes the brain swell worse and makes them get worse. So everybody must learn, do not do an apnea test. You almost learn it now. And you have to know it. I hope you never have to use it on your relatives, but you need to learn it. Do not do an apnea test. No one should ever have the procedure of an apnea test. And then you have to know that the overdose of drugs, they need time to heal. You know, right now, and I got a text as I was coming in from the father of a girl in Canada, Takesha McKitty. You can Google her if you want, Takesha McKitty. I was talking in New York, and I was going to New Jersey the next day, and they called me and asked me if I would help with Takesha. So I went to Canada to help her. She overdosed on September the 14th. On September the 20th, they issued a death certificate on her. She's still very much alive. She moves her feet, she moves her legs.
But she has a death certificate?
She has a death certificate. She has a death certificate on September the 20th, and this is December the 5th.
And she's still alive?
She's still alive, yes. But
with a death certificate?
But she could have had her organs cut out on September the 20th, but by going there, put a stop to that. So she was not dissected. Everybody who has their organs taken, they're all dissected alive. There's no organs you can get from a cadaver.
My wife will go crazy when she hears this, because she's donating her organs if she dies and has a car accident or anything.
Yeah, she should not be an organ donor. And so what she has to do, she must go back to the License Bureau and revoke that. And the law says it's a revocation, it's not a refusal, and they can still get her organs. And that law has been passed here in Ohio. So you asked as we came in, have I been here before? Yes, I came here to testify against that law. And so then when they had hearings 2 weeks later, I came back again, and they said, we ordinarily don't allow people to testify more than once. Well, what is that kind of stuff? What kind of outfit do we have? So I didn't say anything, but then they said, but we'll let you testify because you're a doctor. And I think to myself, why should they let me testify versus anybody else more than once? But in the state of Ohio, every representative and every senator voted for the bill to make it so that everyone is an organ donor. And it's presumed that everyone is an organ donor, and it's presumed that everyone has consented to everything to be done to them to see if their organs are good for someone else and to keep their organs in good shape till they can find someone to give them to. It's really, I think it's against Article 13 of the Constitution of the United States, and I think it's against the Article 8 of the Constitution of Ohio. I might have the 8 and the 13 mixed up between Ohio, but I think it's against the because those are. Hang on, just 1 second. Hello.
So what are you?
What did you want? Yes, can you call me back? I'm busy right now. Thank you. Okay, bye. Sorry about that. But the law, it's called the Uniform Anatomical Gift Act. It's already been passed in 47 states, including Ohio, and every representative in Ohio voted for it. Only one senator voted against it, and that was a black senator, because I think she might have heard what I said, that it's a form of slavery. They've made slaves of all of us. It's involuntary servitude, what they've done. And I think it's against the Constitution of our federal government and the Constitution of our state government. And so the law says, though, if you have signed up to be an organ donor and then you go back to the License Bureau, the law says that's a revocation, but it's not a refusal. You must have a document of refusal. Your wife must get a document of refusal. Now, you might say, and I don't know how old your wife is, but compared to me, she's just a kid, I'm sure. But
Same as me, 75.
just a kid. The oldest organ donor that I've read about was 91. They will take organs from anybody. It's just that they have Class A organs. Those are 16 to 30, and then as you get further away from that, with different ages, different diseases, like they have taken organs from people with AIDS. Granted, they give them to other people with AIDS, but they're Class B organs. They have Class A organs, Class B organs, and that kind of thing.
So that document of refusal, it has to be an authorized by an attorney that you presented to the Bureau of Motor Vehicles?
I'll give you something that you can do.
Okay.
I'll give you something that you can take with you. Now, the point about where your focus has been on vaccines, and rightly so, something stimulates you to become focused on that, whatever it is. And that's part of why I asked some of the questions I ask as to how you get involved. And I've told you a little bit about how I got involved, and I also told you I'm one of the leaders in neonatology for many years, and then because of this brain death thing, I've gotten off into paying attention to that and teaching people that about brain death. Brain death is a mendacity, and you might go home and look up the word mendacity. It's not a new word, and the first use of the word mendacity was around 1300 when it was used. At least that's what I found, and it had to do with some false religion. And mendacity means a lie, a deception, but it's a deliberate deception to mislead you, and that's why I think it's the best term for what brain death is. Everybody who's brain dead, everybody who's called brain dead has a beating heart, circulation, and respiration. If they didn't have that, you wouldn't have to call them brain dead. You could call them dead, but they're all alive. So, anyway.
Do you mind touching on your background?
What's that?
A little bit. Do you mind touching on your background a little bit, please?
My background?
Yes.
Well, first of all, I was born in Norwood, Ohio, and went to Xavier University in Cincinnati, and then I went to St. Louis University to medical school and trained as a pediatrician, took care of children with leukemia and tumors for about 6 years, and during that time saw how many infants died and there were no treatments, and so it seemed like we should be able to do something. I mean, I was at a children's hospital where we did things for children of all ages, but not infants. And so I started a special care nursery in 1963, and continued there, taking care of babies, and then I went other places to do the same thing. So my wife and I have 12 children. We have 35 grandchildren and five great grandchildren, and we're going to have a new grandchild in a month or so.
Congratulations!
It's so exciting because we haven't had a grandchild for about 4 years. So
Now I'm assuming that the new baby doesn't get hepatitis B hours after being born.
let's hope not. You see, one of the things that you have to know is that, yes, you're paying attention to what I say. My children pay attention to what I say. Do they do anything about it?
Failure to implement.
Well, I say it like that because I've told many people what to do. They don't do it.
Sure.
You've got to do something to protect your life. And,
You're right.
and yes, you do have to do what you're doing. You do have to come down and meet with the senator. Can you change the law? No. She can if she wants to, but the only way that she'll do it is if she gets an incentive to do it. And what's the incentive? It has to be for the babies that are in her constituency, or whatever you call it, and she has to care about them enough to speak up for it. Doesn't mean that she will be successful, but there's no reason to give hepatitis B vaccine to any baby. There is no reason. You can study the mother, and if there's something in the mother that says do it, that's a different question.
Right. But to just universally give every baby, including preemies.
That's completely wrong. See, and then we mentioned autism, and yes, if you give a dozen vaccines, it could be just one of them could be related to autism. It could be that none of them are related to autism. We don't know the cause of autism. All we do know that males get it more commonly than females. We do know that they repeat. There are some people that focus on the vaccines, and some people focus on the live vaccines and that kind of thing. And I'm not opposed to that, but you have to know that when I first started to learn about polio, we had to memorize 15 different possible causes for polio because we didn't know the cause. And then in a few years, the virus was identified. Then there's only one cause once you identify the polio virus. There's several different strains of the polio virus, but there's only one cause of polio once you identify it. Autism is like that. There's certainly an increased incidence of autism, and that's factual. And it isn't just a matter of
Especially since the
being
1986
closer
yeah.
observer. There's an increased incidence. It's probably something to do. Like one of the things that one doctor has written about that is related to early clamping of the umbilical cord, and one of the things that I tell a lot of people about is there is no reason to clamp the umbilical cord.
They've actually changed, the ACOG has changed that recommendation, and they now recommend late cord clamping.
I know,
but it's not trickled down into practice yet.
Yes, but it should. But I've been saying it for 40 years.
You're a forward thinker.
Yeah. Well,
It's just, you're looking around like, this is just common sense, people.
well, but I know a lot about going to different places and getting them, and then they eventually they pay attention to me because they see the good results.
Sure.
And there's all kinds of things that happen when you clamp the umbilical cord, because see, in the cord is where the blood
stem
is that the
cells
baby uses to expand the lungs, and if the baby's deprived of that, and then the late clamping that you're talking about is 30 seconds or a minute. No.
Longer.
The cord should not be clamped until the baby has adjusted very well from inside the uterus to outside the uterus. And the 30 seconds or a minute is just how they did the experiment. I'm not opposed to
Wait.
doing things in a precise way to do experiments.
But you're saying the clamping of the cord should be based on each individual infant and how they're adjusting to life outside of the womb.
Absolutely.
Okay.
There's no, see, some of the animals, the cord doesn't get cut until the mother bites the cord. Okay, so, and you see, if God intended for that cord to be clamped, he would make mother's fingers like this. Okay.
Right, I hear you.
But he didn't do that. So God never intended for the cord to be clamped.
Right.
And God intended for labor to be like it is. And yes, we wish there was no discomfort, but there is. But all of that is discomfort to squeeze the baby. And when the baby gets squeezed, you see, the baby begins to have breathing movements. Do you know when? 11 weeks after conception.
They start breathing the amniotic fluid in, don't they?
11 weeks after conception. I can remember that.
11 weeks.
11 weeks after conception, breathing movements begin. The lung fluid comes only out. It doesn't go into the baby. So you see, the lung fluid is pure lung fluid.
It just comes out.
It comes out, but you see, it comes out in such a way that it doesn't empty out. It comes out that some of it moves up and then down, and up and then down. So the algebraic sum is to go out, but then what's out here, it's impossible to get into the lungs. So the lungs have only pure lung fluid.
Got it.
It's impossible until they rupture the membranes. So membranes should not be ruptured.
They do that. They
Of
rupture
course they do it.
membranes to
Don't you know
stimulate
why?
labor. Why?
So they
Keep the
think
baby
they
out?
hurried up things up so they can go off and have a beer.
Well, that's why they do the cesareans. That's why
That's
our
why they do the
cesarean rate-
cesareans.
It's a scheduled birth.
It's all scheduled. Yes, it's all scheduled. See, in my early neonatal life, I spent much time at nighttime. In the last few years of my neonatal life, I hardly ever got out at nighttime.
Because of the C-section.
Because they induce
9 to
them.
5.
They induce them to deliver in the daytime.
Wow.
Yes.
Do you mind talking about as well of how
Talking about what?
your everything that you introduced with your neonatal program?
I'm sorry, I didn't catch the question yet.
Your basically your neonatal
Yeah, I'm
background
a
and how you got that
neonatologist.
started. And how you got that started. Do you mind touching on that, please? And
How I started
what
to
sort
do
of
it?
innovations you contributed to?
Well, the first thing is we observed that many babies died, and so I was in a children's hospital where we took care of many sick children, but there was no treatments for the babies, and so I was in St. Louis. I went to the administrator and suggested that we do this. He said, "Who's going to pay?" So I went to the NIH, but they would not give me any money. So I went to the Children's Bureau, and they would not give me any money. So I went to the state of Missouri, and they would not give me any money. Went to the city of Missouri, the city of St. Louis, and they would not give me any money. So I went back to the administrator and said, "Look it, babies die, and nobody's doing anything, and we should do something." So she said, "All right, we'll try for a year and see what happens." So the first year I got 30 babies referred to me. And by the time I left there, I was getting more than 600 babies coming from more than 50 hospitals because I educated people that there are treatments that can be done for babies. And in the beginning, we had no treatments. The only thing I could give was sugar and bicarbonate in the vein. But we had no treatments, and so I started in '63. We really did not make an advance in the treatment of babies till about 1970, and then we started to find better ways to breed for the babies, and then from that, then we kept finding better ways to breed for them. We did the other things with nutrition too, I was very interested in sudden infant death syndrome, and sudden infant death syndrome there is a relationship with vaccines with sudden infant death syndrome. But one of the things that we identified was magnesium deficiency, and we identified the babies who died. We showed that they were deficient in magnesium, and then the premature baby is born before the baby gets the stores of magnesium and iron and that kind of thing, and so they're deficient in magnesium, and we studied about 100 babies that did not get magnesium, and 5 of them died of sudden infant death syndrome, and 20 others got readmitted for some kind of difficulty with breathing or something. Ones we gave magnesium to, there were no deaths, no readmissions, and it wasn't a random selection, but the ones when we identified a need for magnesium, and we had you cannot test for the need for magnesium from just a simple blood test.
Because that's serum. We're talking about intracellular magnesium.
Yeah, intracellular magnesium.
Gotcha.
And so the way we did it is we did a magnesium loading test, and we would collect all the urine for a period of time, give a standard dose of magnesium, and then collect the urine, and then see how much they retained. And those who are deficient in magnesium would retain all of the magnesium.
So you were looking to see when the magnesium started to show up in the urine.
Yes,
Basically.
right. Yeah. So
And that's the test for intracellular
magnesium,
saturation,
right?
I guess.
Yeah, and you have to do it that way. You can't
But
tell.
you know, they always testing the blood for magnesium levels in the serum.
Yes, it's a waste of time. It's a waste of time, pretty much so. If you ever got it low in the serum, it would be extremely low in the cell. You can get very low in the cell, and the serum still is normal. It's the same way with potassium.
Right.
You know, the same principle with potassium because of how God made the body, you know, and how we can test it. But we were the ones that identified the relationship between magnesium deficiency and sudden infant death syndrome, and then we went to the manufacturers of milk and for babies, a formula, and told them that they had to be testing for magnesium, and they do test now. They make sure they have a certain amount of magnesium, and so we had that input. We also showed the need for copper and the need for zinc. And another thing I'll tell you about that's one of the most exciting things. I mean, I have a lot of things. God's good to me to let me do what I've done. But one of the most exciting things is when we started to give nutrition in the vein. You know, we could give glucose, so then we added protein, but we didn't have any way to give fat, and the babies would get deficient in fat. And so we would put oil on their skin, trying to get the fat in. And safflower oil worked the best, but it didn't work very well. So we couldn't so I smuggled some intravenous fat into the country, and we gave the intravenous fat, and in 24 hours I could see healing. In 48 hours, complete healing. I have these pictures that I took at that time. It's so exciting.
I think they put lipids in the TPN now.
Well, they do, but we didn't have
But back
lipids
then
then.
there was no lipids.
We didn't have. You see, we didn't have
Right.
lipids. See, all these things that you people that.
But see how you had to figure that out, because the consensus was saying no.
Yes, I know, but you see, we were able to do it before there was all this stuff of getting in our way. We
Got
were
it.
able to be doctors.
Yes.
You know, and
Thank you.
see a doctor.
Practicing the art of being a physician.
Right, a doctor and nurse, what we do is protect and preserve life.
Right.
And never do we have anything to
true.
do with hastening death or shortening life.
But there's so many regulations now that they restrict what you can and cannot do or say.
Right, and all of that is put there, but there's a whole lot of that kind of stuff too that's not right. But you see, what I'm really saying is yes, the 4 of us now at least have met each other today. Okay, so there is common ground. And the common ground is the specialness of the person. The common ground is that we protect and preserve life. We do nothing to harm or to the patient or shorten life. And if there is something like a vaccine, then before it gets done, it gets investigated and studied and that kind of thing before we start using it on everybody. And we try to use it the right way. So you have to have a foundation that you build on. Now, you see, there are things like emotions, passions, and feelings. And that often is, those are motivating things. They're good, they're human, but you have to have something more solid than any of those if you're going to start making changes that are going to affect lots of people.
How did you notice the connection between SIDS and vaccine? What drew you to that?
How did I do what?
The connection between SIDS and vaccine, what drew you to that? How did you have, with your years of experience?
With the
that
vaccines, of course.
Well, a lot of the package inserts are correlating vaccination with apnea or breath holding spells in the infants.
Well, yes, but you see, what happens is that you have the vaccine and then you have apnea, and they can just be coincidental or they can be related to each other.
Got it.
But babies have apnea, they die whether you give them vaccines or not. The vaccines just increase the incidence, but they're set up to do it. They're set up to get it. You know, like the sudden infant death syndrome, there could be a number of things that makes the baby get that, but they're set up to it. It's autism. But, being a male sets them up to it more than being female. That's the first thing. And then some people are more prone. Like I can remember some patients where the child had autism, and then the next child had autism too, and didn't have vaccines or anything. So there's something, but it isn't just simply runs in the family. Diabetes is inherited, but everybody doesn't get it.
Right.
And childhood diabetes is related to what? A virus. It's related to virus. What virus? Mumps virus can do it, adenovirus can do it, but they're set up with a genetic tendency, and then the child gets that, and they get type 1 diabetes. Type 2 diabetes.
Seems like I saw a video recently where they were actually studying a vaccine against type 1 diabetes, but they were doing it by vaccinating for a certain enterovirus.
Well, right, there are a number of different viruses that can do
cause
it.
type 1
But
diabetes. Is that biomimicry in nature where the proteins on the virus are similar?
They have the natural tendency, the inherited factor that makes them get it.
Got it.
Yeah,
So there's a genetic predisposition and association with the infection that leads to type 1 diabetes.
Right.
So the same would be true with SIDS. The vaccine is the
trigger, yeah.
Okay,
right.
so
Call it trigger,
babies already are predisposed to apnea. You give them a vaccination, and certain ones that are more genetically predisposed.
but their predisposition to the apnea can be deficiency in magnesium. That's one of the causes. I know that that's one of the causes of sudden infant death syndrome.
Right.
How do I know it? Let me tell you, I studied it for
studied
years.
it, right.
I studied it, I published, but they don't pay attention to me. But
No,
I
they
know.
they're definitely not testing
Right.
urine for magnesium levels and doing
Right.
tolerance
Right.
tests, so.
Okay, so anyway, we are together, but the common denominators, it has to be a search for the truth, and human beings, there is a Latin word, viva, but I'll give you an English word, live. And we have our existence, and the existence has to do with how we are made like God. And then the I is the intellect. See, and the intellect is the power of the spiritual of the person. It's to search for the truth. And then the V is the voluntary. It's the will, which is the search for the good. But see, that's a power of the soul. And then the E is like hearing, but with a silent H. See, and hearing is how we learn as infants. We learn from our mother, we learn from our father. We learn what's true and what's good. And it doesn't make any difference if our parents speak English, Chinese, Japanese, the baby still learns what's good and what's true. See, and so that makes us different from the beast. See, because why? We have the powers of the soul, the powers of the spiritual. Yes.
So it's, I mean, I see this trend in medicine towards what I like to call checkbox medicine, where it's almost as if the physicians and the nursing staff aren't thinking anymore. They're just going down a list and checking off that they completed a task without actually looking at the patient and assessing and evaluating what their individual needs are.
Right.
And I think that's a very slippery slope, and it's a dangerous
terrible
practice.
See, but that's how they get paid. See, that's
So here we come back to money.
but that's how they get paid, and if they
Right.
don't check the boxes. See, like when I practiced, I could write on my chart, I could put PE, physical exam, NEG, negative. Okay, now I can go back to any chart because I know every chart that I wrote down on, I looked at their ears and their eyes and their mouth and their throat, and I listened to their heart and listened to their lungs, and I palpated their abdomen. I can tell you, if it has PE negative, I know what that means. And I didn't, could it be a checkbox so I could just check that? Yes, I know what it means. But they won't let the doctors do that because someone wants to control the doctor. There's nobody controls the doctor. They can control the doctor's checking the boxes, but they can't control the doctor. The doctor, the only one controls the doctor is God and himself. And so then
I agree with you. However, they're churning out these young doctors these days.
They don't even know.
They have no education and almost like no intellect. It's like they're just
They have no intellect, you're
they're
right.
just regurgitating what the textbook told them to do without actually applying that clinically.
not only the textbook, but their teacher.
Sure.
And so they know they have to do what the teacher says or they don't get a good grade.
So they're basically learned to be repeaters, not actually practicing the art of medicine.
You're right.
Okay.
Yeah, you're right. And it isn't just the doctors, it's the nurses too.
It's the nurses too. I agree.
But you see what has occurred. See, and when did it occur? It occurred in about 1968 is when the major thing occurred, because that's when the lie of brain death came about, and everybody who accepted brain death knew that they had those patients had a beating heart and circulation and respiration, and they knew it was a lie.
So that was the very beginning, the first step of deceit in the practice of medicine.
A major
we can
step.
convince you of this lie, then we can convince you of
Right.
anything that's a lie.
Right, it's exactly right.
Right.
And just like all lies, once you tell a lie, you have to tell another one or two,
The web gets bigger.
Got it.
and it keeps on. Anyway, okay.
It's getting late.
I'll
Thank
give
you so
some,
much.
I'll give you some things to take with you, because if you're going to do this vaccine thing, you're going to have to do more. You cannot be stuck on vaccines because they, and I'm not opposed to concentrating on vaccines, but you got to do more. You have to protect and preserve life from conception until true death, and conception is the proper word. They will try to get you to use fertilization, but fertilization, that's what happens with the bulls and the cows, and what happens with the roosters and the hens, and what happens with the corn and the bees. You know.
Birds and the bees.
But that's not what happens with persons. Persons love each other because God loves us. persons love each other, and there's what happened was that God created the heaven and the earth. The heaven was the angels, and the earth is the elements. And out of the elements, he formed everything else. He formed it and set it in motion, and everything is set in motion. And it all repeats itself. It gets warmer and it gets cooler, and all this stuff about global warming, all that stuff, it's all bunk. And there's no.
It's a cyclical pattern.
It's what?
It's a cyclical pattern.
Of course.
Heating, cooling of the earth is
The only thing that's new is the person. And God creates the person, and then God picks out the mother and the father. And then the body is formed using what? The elements. The elements that are in the sperm and the egg, and that's for the formation of the body. See, so the person is created, and then the body is formed. All of this happens immediately. We don't know how it all happens, but each person is special and unique. And so what happens? We get our life, we get a chance to do something for ourselves, for other people, for God, and God just didn't give us just free will and let us do what we want with it. He even came on earth and taught us how we should behave, and so here we are. Okay. I brought you a couple of things because I anticipated that maybe you might be here.
Thank you.
Here's a booklet.
Thank you.
A booklet. Now,
Oh wow.
the booklet you should read, but this one's not good. That's an old one. I picked them up quick this morning. Let's see if I gave you. Yeah, let me see yours. Yeah, you're okay. This is an earlier edition. It looks pretty much the same, but it's a little bit different. But if you go to the last two pages, the last two pages has how to protect and preserve your life, and you can notarize it. Now, those last two pages, I'll get them in a minute. Those last two pages are like this card. The last two pages are like the card, except the last two pages can be notarized. The card can't be notarized, but the card tells you that if you get sick, you want to get treated. It says, "I wish to live the lifespan given by God. I direct that all medical and surgical treatments and care, including nutrition and hydration, be given to protect and preserve my life. Do not hasten death, do not shorten life, do not do an apnea test." That's what I told you about. Do not take any organs for transplantation or any other purpose. Anyway, the last two pages, just like the card, except you can notarize the last two pages. Now, the other thing you need to know is you must have a power of attorney, and the power of attorney in here we give you a power of attorney for health care. I'm not an attorney, but we tell you the language of what has to happen to protect and preserve your life. You should designate your wife to speak for you. She should speak for you.
She has it for me and I have it for her.
But she should only be able to protect and preserve your life. So many of the powers of attorney are set up under certain conditions. The power of attorney can kill you. I always tell people, make sure you give the power of attorney to someone who loves you, not someone who would love to get rid of you. Yeah. And at least I'm sure that my wife probably wanted to more than once. And then there's also in here is the directions that can be used for children, for minors, or for somebody who is mentally incapacitated. And the rest of the book you should read because it has to do with brain death and organ transplants. And my email address is inside the back cover.
You know, with OAMF does a lot of like community outreach events. Do you have a bunch of these that would you like us to start?
Sure, I do.
Putting them on our display and talking to people about preservation of life? Because I think
you should have them.
That kind of goes hand in hand.
I can get more to you. Now, I'm going to give you something else too. And
Thank you.
this is a brochure. American Life League prints it for me, but I wrote it. I say I wrote it. I wrote it and had a lot to do with it, but it tells you about the ventilator. The ventilator is commonly called a respirator, but it doesn't respirate anything. It just moves air, just ventilates, that's all it does. And all it does is move air in. It doesn't move it out. Only the living person moves it out. So you have to know about this too. So,
which is interesting. That kind of sounds like the action that you were explaining a fetus has in the mother's womb.
Sure.
It's a motion of out, not in per se.
You're making me think I didn't tie those two together. Well, anyway.
She's brilliant.
It was just interesting that connection.
They're all related to each other.
Yep.
So, and that's why I have asked several pulmonologists, now tell me about that ventilator, and they don't understand that it doesn't push the air out. If I get them thinking about it, then they catch on. But you see, the way that we breathe is kind of like a rubber band. That when the rubber band is laying on the table, it's not doing anything. And we stretch it. When we stretch it, it comes back. Why? Because it has the ability to store energy to contract. That's the way we breathe. So when we take a breath in, the muscles of our chest and our diaphragm contract, make the chest get bigger, and air goes in. Well, what happens then, those muscles store energy. So when it stops going in, then it's the same energy that's stored that makes it contract. But we don't do it. You know, our body doesn't do it. Our body only takes it in. After that, and it's the same way with somebody on a ventilator. Pushes the air in, but it doesn't push it out. It's only the living person that pushes it out. Ventilator only works on a living person, cannot work on a cadaver. So, anyway, I think that's the main things I brought for you.
Well, we appreciate that, and if we can order these brochures off you, we can start having them at our tables at the various events we do around the state.
That has my name on it, and so you can look up our website, lifeguardianfoundation.org, and you can read more about it. And the issues do not have to do with religion. The issues have to do with persons. And religion has to do with how to worship, but it doesn't have to do with the specialness of the person. Each person is special, no matter whether they're Protestant or Jewish or Catholic or no religion. The person is still special, and so it's important to know that. And then the issues that we talk about, it's important that we learn them. Like you're an astute person, and I've tried to get you to sharpen your focus.
Yeah.
Okay, you do really good, but you have to sharpen your focus.
Sure.
You can get in touch with me anytime,
Okay.
you know, if you know what I
I
mean.
appreciate that.
And I have plenty of things to do. I don't look for things to do.
I appreciate you reaching out for that. I
So,
have a
so
hard time.
where
raising
was I?
it.
Recently, I was in Los Angeles, and then I was in Omaha, and last week I was in South Carolina. Sunday, I'm going to England. I'm going to England to help a baby that they want to kill the baby, and they've been trying for months. And so I've been helping the mother and father. So they asked me to come, so I'm going to go.
This is the baby's. They're trying to say the baby is brain dead.
No.
Oh, okay, something different.
The baby has seizures and
Okay.
is on a ventilator, but has an endotracheal tube for 8 months. And that makes it so that the baby has to stay in the hospital and can't go home, and makes the baby get worse, because that endotracheal tube ruins the airway. So the baby needs a tracheostomy, but they won't do it because they want the baby to die.
Because they want its organs.
Oh my goodness.
No, they would take his organs. They'd be happy to get them, but they just want him to die. See, the brain death, and organ transplants is what made the system of death happen. The system of death says that if you are young and developing, that's great. If you're 25 and beautiful, or 25 and strong, that's great. And anything away from that, you're not so great. And then,
So we're not so great.
We're
Then-
just not so great.
you see, you don't know it, but when you get to be like 65, and the nurse says, "Would you fill this out before you come back?" and ask things like, "Do you live by yourself? Do you need help in dressing?"
Oh, they're grading you. Are they grading
Everybody
you?
is graded. Everybody is graded. You've been graded too. You don't even know you're graded. Do you buckle the seatbelt when you get in the car? And all of those things, and they get this information on us, and then all of that determines whether you're going to get treatment or not.
Is it? I mean, is this like in socialized medicine?
It's
or?
right here in the United States. Yeah, it's right here. It's socialized medicine, but it's even worse than that, because you see, you're used to hearing about a hospice. People get into hospice when 2 doctors say you're going to be dead in 6 months. But you get into palliative care when they have these triggers that put you in palliative care. And palliative care is no treatment, and it's only care for whatever they want to give you care for. And it's palliative care is the evil that's going throughout our society. And the way that they organized Obama getting elected was the Alinsky approach, and getting small people in small communities to get organized. And that's how he got organized. They organized the palliative care through the churches. Most all the churches have nurses that are part of what's going on. They have the leaders of the church saying, you really should have this advanced directive. Not like I told you, the advanced directive, which is a power of attorney, but the advanced directive, the living will, or other things that says you don't get treatment, you should get that in place. The POLST form, POLST, MOST, those are all things to give you less treatment. You should not have that. You should want to get treated because you want to live as long as God gives you to live, and you don't want someone to shorten your life or hasten your death.
Right.
This is all part of the system of death that's going on in our society. And you have focused on one part of it, which is very, very important. I'm just encouraging you to realize there's more to it than whatever you've been doing. And the same as I am part of what you're doing, you have to be part of what I'm doing too. I say you have to be. You know what I mean. You don't have to do anything if you don't want to. But
No, I think that it all goes hand in hand.
it's all hand in hand
it's
because
definitely within the confines of what our organization stands for, which is preserving the medical freedom of all people, and the medical freedom, including the right to live.
now I want to tell you about the word freedom. versus liberty. Should-
Uh-oh.
Okay,
Do we need to change our name?
I didn't say that, but you need to know the difference in the words.
I think I.
Liberty is a special word in the Declaration of Independence. It has inalienable rights, inalienable gifts. What's inalienable mean? You heard of
God-given,
alien
yeah.
from the outside. Inalienable means it's from the inside.
Yeah.
Okay, so inside, inalienable rights, inalienable gifts to what? Life, liberty, and the pursuit of happiness, not freedom.
Gotcha. Freedom is more of a right that's given to you now. That can be taken
Freedom
away.
comes from man.
Sure.
Liberty comes from two Latin words, liber, which means desires, and arbitrium, you put it together, you get liberty. Arbitrium is like arbitrary, but it means mastery. In Latin, the words are reversed. And so it's mastery over desires. What's mastery over desires? It's to do good and avoid evil. So you see what you should stand for is liberty. See, freedom comes from man.
Yeah, and it
You know,
can be taken away.
Recently, I think President Trump gave freedom to some prisoners. Certainly before Clinton got out of office, before Bush got out of office, he gave freedom to some prisoners. So you see, the president can give you freedom.
Got it.
If you rent an apartment, you can eat in the apartment, you can sleep in the apartment, your friends can come in the apartment, but you can't raise chickens because the landlord wouldn't want it.
Yeah.
Could you pay extra rent, and would the landlord let you raise chickens? Yes, but you have to pay for it. But he has the power to give you freedom to do that.
Gotcha.
See, the power for freedom comes from man. The power for liberty comes from God because of how we are. And and people use those two words, liberty and freedom, interchangeably, but they're different words,
Yeah.
and they have different things. It's pretty simple, but it's one of the things that I try to encourage people about. Now I'll tell you something else.
Love it.
There's only three things that are free. Okay? I taught all my children this. I taught them nothing's free. You either pay for it up front or you pay for it in the end. But there are three things that are free. The first is your life. Okay? The second is grace. Grace is what you get from God. And the third one is the free space in the middle of a bingo card.
What?
The free space in the middle of a bingo card. Takes unfair advantage of you. I apologize. But
There's a lot of those cards in the bingo in the Catholic churches.
now, just so you know, I actually the life and the grace I've said for a long time. But my sister's 95, lives in kind of a nursing home. It's pretty nice where she lives, but they won't let me play bingo, because only the residents there can win. and so, but they give me a card. So they were playing bingo. So I look at the card and it says free. I said, next time I ask somebody about the life and the grace, then when I get their attention, I will tell them about the free space and bingo. And they all react just like you do. It's fun. I hate to take advantage of you that way, but it makes it kind of fun. And it makes it worthwhile telling other people about it, because you don't get much chance to tell people about the gift of life or the gift of grace. You know,
You're right. You're right.
but if you can get their attention long enough, and then I bet they'll remember the free space in the bingo card. Maybe even more.
Grace is something that you don't deserve. Matter of fact, if a professor's teaching and you really fail a test and he gives you a C, it's only by grace that you passed that test.
That's exactly right. So
You don't deserve it, but
you
you're
don't
given
deserve
it.
it, but you can get it. You don't deserve it, but you can get it. Now, and sometimes, like on Thanksgiving, I wanted to go to church while I was with children and grandchildren, but nobody wanted to go to church. So I said, now I have to carry the grace home for all of you. Yeah, but see, we live in a world where we lose track of these things. And so while you're focused on the vaccines, focus on the whole of life and across the board. And that doesn't mean that you can't have different ways that you worship God. You can have. Most of the people don't pay attention to theology. They're doing whatever they're doing because it's Sunday or Wednesday or whatever it is, but they're really not focusing. So, and I can't tell you what to do about that. I can encourage you about the vaccines. You're doing the right thing. And vaccines, though, do some good things like tetanus. I've taken care of 3 patients with lockjaw. I know what lockjaw is, and it's a severe disease, and it's preventable with the tetanus vaccine. And so I think that people should get the tetanus vaccine. Some people are just against all vaccines. No, there can be something good in here, but you need to pick and choose. And I don't think that we should ever get vaccines from aborted babies. I think that's wrong. But you can't get an MMR right now unless it's from an aborted baby.
And I even think that the DTaP and TDAP have fetal tissue in them.
I brought that too.
I think they have MRC5 in them.
I brought that in case you wanted to have a list of that.
DTaP has. I think it does. Yeah, I think it does.
You probably have seen it.
Look at that. Any vaccine listed above does not use. These are the ones without.
Oh, thank you.
The ones that are in red are the ones that are from aborted fetal cells, and then the ones that are in black are from other ways. But right now,
The DTaP has. Yeah, it has.
Well, do we want to continue or?
I didn't know that they had a vaccine for this. What is this? For the adenovirus? There's a vaccine for the adenovirus?
which virus?
It says the disease is for acute respiratory. The product name is adenovirus 4-7 oral.
The first one.
The first one.
First one right there.
Oh, acute. Oh, adenovirus. Adenovirus.
Adenovirus?
Yeah, like the adenoids.
Yeah.
Adenovirus. Okay. Of course, you can have those, but it's made from fetal cells, so nobody should get that. It's a cold. It's a cold. Why would you get something from an aborted baby?
I didn't know they had a vaccine for that.
That's the reason I came. I'll give you this too. It's in the booklet.
Good grief, there's cell lines on here I've never heard of.
Is there 2 in there? I'm not sure. Felt thick. Let's see. No, yeah, it is 2. There you
Wow,
go.
you've looked into this.
Thank you.
Oh man, someone needs to send this. Someone needs to send this to Judy. She probably already knows.
Well, you can.
Scan it.
Can I make copies of this?
Yeah, you can print it off yourself. It's cog4life.org. It's either .org or .com. COG, you can remember it
Yes.
because Children of God.
Yes.
cog4life.org or .com. It used to be .org, and I think they changed it to .com. And you can print it off. What I do, I have it printed and I keep it right there in my kitchen because people call me and ask me questions, so it's handy.
That's good.
So,
That's a good idea.
See, and so, yes, be concerned about vaccines, and yes, be concerned, about the things that are happening as a result of the
absolutely.
vaccines, and so anyway, be concerned, but then get the reasons to be concerned, and get the solid foundation to hold on to. See that and so you will have your emotions, you will have your passions, you will have your feelings. You have children, and you got to have them. But on the other hand, use that to build on and do the other things too.
Absolutely. That's why we do what we do.
Do all three of you live in Columbus?